Okay. Assalamu alaikum and good afternoon from Malaysia. Thank you for joining this 38th MedEd webinar on elective courses in medical education. With this, the MedEd webinars and workshop series starts its 6th year. And thank you very much for all of you for your continuous support. Now, coming to the topic of elective courses in medical education, let's look at the learning outcomes which we want to achieve in this session. So by attending this webinar, the participants will be able to, number one, explain the underpinning principles of introducing elective courses or posting in medical education. It's important to realize the basis. Second is the rationale for conducting elective courses and postings in undergraduate medical students. Why really we want to do that. Third is the activity, the kind of activity that can be offered in undergraduate medical students' elective postings. Fourth is to assess undergraduate medical students for their performance and activities during elective posting. And finally, the ability to plan and implement a sustainable, effective elective programs in undergraduate medical education. So we have tried to cover a comprehensive list of learning outcomes about elective postings in undergraduate medical students. Let's look at some salient points first before we move on to the details. In modern medical education, there is a growing importance to include the elective programs in the undergraduate medical curriculum. And this is published a paper in 2020. Electives are the curricular contents that students choose freely as part of their training. I think important word here is curricular contents. So electives are related to the curriculum. And we know that there are a number of topics related to the curriculum which are not taught formally or taught only superficially during the medical course. And students can choose these topics for their elective postings. So in this way, the electives are directly or indirectly related to the undergraduate curriculum. So we should keep in mind that electives are nothing out or unrelated to the curriculum. The third point, these courses are designed to prepare the students for the future careers by increasing professional opportunities. So students can explore the areas they may take up as specialty in their future career, as well as these elective courses are posting, try to kind of the holistic development of the future graduates. Elective courses allow students to have varied learning experiences outside the fixed curriculum. So although the activities are related to the curriculum, but they are not formally included in the mandatory curriculum which is taught. Electives permit interprofessional education. Means that because students can choose electives which are related to in other healthcare education program, maybe for example in dentistry or nursing or physiotherapy, etc. So this can permit or promote interprofessional education, which is very, very important component of training undergraduate medical students. And at the same time, it enhances students' interest and motivation in the program. Reason being that they select their own topics, their own choice, and in this way, they feel more responsible and they improve their personal skills. Electives complement the core curriculum. We should always keep in mind that the not the negative side, that electives complement the core curriculum. They do not go against the curriculum. Elective courses lay down the foundation for the students to become self-directed learner, as these courses are opted by the students on their own. Obviously, the course or the topic is chosen by the student and they have to work on that. And in that way, it really very strongly promotes the self-directed learning. A little bit of history of electives. Historically, the optional feature is obviously a salient feature of elective in an educational program, was part and parcel of curriculum of many schools even during medieval period in 5th to 15th century. So this is not something new, in fact quite old. In 1819, the concept first appeared in the United States in the curriculum of University of Virginia. Howard introduced it in 1826, nearly 200 years ago. Electives were advocated to be introduced in the secondary schools as supervised courses during the late 1890s. Around the same time, electives started gaining importance in medical schools curriculum of the United States. These are the references for the previous quotes. About 40 years ago, can you mute yourself, please? So about 40 years ago, Hardin introduced the educational strategies model, or the SPICES model of educational strategies. And what it states is that in a standard medical education program, all students pass through a set of prescribed courses with few, if any, opportunities to study a subject in more depth or to study a subject of their own choosing, which has not been covered in the program. So that's what the traditional our curriculum is, that where everything is mandatory, and the whatever is included in the curriculum, there whatever level is to be taught is already decided. So that is the standard medical education program. But when we come to the electives, and then we have a flexibility in our curriculum to introduce electives. So in recent years, just realized that this was written in 1984. There has been a significant increase in curricular flexibility where electives are incorporated into the program. This is the SPICES model, where from traditional curriculum to new innovative curricula, from teacher-centered to student-centered, from information gathering to problem-based, from discipline-based to integrated, from hospital-based to community-based, and from standard to electives, and from based to the systematic. So that is what the Hardin introduced, that from the standard curriculum going to the elective component of the curriculum. Elective programs can be a number of forms. They may be intercalated years of study in the curriculum, during which time students can select one or more subjects to study in depth. So they can be even options for students to let's say take a break from the regular study and go on to do some electives, which may be sort of uh, a long course as well. In one of my medical school, students were allowed to take 1 year off after completing their preclinical education. And then our medical school had an MOU with uh, some medical schools in the United States, where students would go for 1 year and do some courses, maybe in basic sciences and in other areas, and then they can come back and join again. So this is a concept of intercalated years, or in other words, which are long-term electives. On the other hand, there may be shorter elective periods in which students can select one from a number of available courses or projects or a subject or an area of their own choosing. And in this discussion and presentation, we will be concentrating more on these shorter elective periods. So now trying to understand what is an elective course or a posting. There is no standard definition. However, we can describe it in different ways. The term can be used to describe many widely different curricular elements, but usually infers a period of time during undergraduate training within which there is a significant element of student choice. So this is a period of time which is included in the undergraduate training program, but students have an option to choose whatever they want to do, of course, under certain limitations during that period. The conceptual role of electives and workplace-based attachments. Usually the electives would be a workplace-based attachments within university education generally, and their influence on employability of graduates is increasingly recognized. This benefit is probably more to other disciplines other than medicine, where the employability of graduates could be increased based on their elective involvement. Undergraduate students' electives can be regarded as a heterogeneous collection of individualized activities, right? So this is, although it can be in groups as well, but mainly it is an individualized activity, which may occur in diverse setting and timings, means that these activities are not in a uniform environment or standardized environment. And of course, they are included in the medical school. So these are individualized activities which may occur in diverse settings and timings within the medical program. Most medical schools allow time for electives once core clinical skills have been acquired, either end of year 3 or end of year 4, where students have acquired basic clinical skills. Then they are given an opportunity to go for an elective because they are relatively better equipped at that time. However, some schools include electives earlier in the course, often with specified aims, such as wellness electives. This are the electives which may be offered during preclinical years, and I will talk a bit more about it, what is a wellness elective. The main difference between the electives and standard program in medical education is that electives are optional courses. They are optional in terms of choice of a topic or an area that student can choose from while standard programs are mandatory courses that all students must take. Now, we have to be clear about these optional courses. The student must do elective, so that is mandatory. But what area they want to choose or what subject or program they want to choose is their own choice. The primary objective is to allow students opportunities to select, direct, and organize placement during their undergraduate training to meet their individualized needs and interests outside the prescribed curriculum. So this is something which is related to the curriculum, but it is not included or mandatory in the curriculum, and students are given an opportunity to select, direct, and organize their placement in different institutions, which is directed by their needs or their interests. So that's how the elective postings are chosen. Electives allow for sharing of knowledge while acquiring new clinical and cultural skills. Cultural skills means that if, for example, there is an international elective and students are going into new places or in different cultures, so it would help them to learn about that culture as well. Many students choose to undertake electives in areas not usually provided within the curriculum. And the purpose is to explore potential career paths ranging from laboratory research to specialized clinical rotations in world's leading institutions. So here the purpose is that students, they want to explore that what future specialty they want to adopt, and what future career path they want to follow. So they would have an opportunity during these electives to choose that area for their elective posting. And if possible, they may get an opportunity to have these electives in leading institutions, maybe national or at international level. The key principles of an elective posting. Number one, clearly articulated purpose and measurable educational outcomes. Means every elective must have learning outcomes identified before the elective posting. Second, comprehensive pre-departure preparation, including communication with the host and consideration of competence needs, cultural conflicts, and ethical challenges. So means that there has to be a quite elaborated preparation before students depart for their elective posting. And we will go into a bit more detail in a short while. Number three, supervision while on placement, both locally and from home institutions. So means that the electives are always supervised. There would be a local supervisor, which is from the parent institution. And then there would be an external supervisor, which would be in the host institution. So it is not an unsupervised activity. It is very much supervised both at the parent institution and at the host institution. An element of undertaking project work, particularly if beneficial to the host. So student has to take an undertaking that whatever the project or the study they are going to do. And of course, the host institution would encourage students to take activities where there is some benefit to the host institution as well. And the number fifth is incorporation of reflective practices before, during, and after the placement. This is an important key element of electives that students have to have this reflective practice. Before elective means that they have to think what they are going to do during the electives, that keep on reflecting on what they are doing. And of course, after the elective, they have to write a report, and which would be mainly a reflection on their posting. So these are 5 key principles of an elective posting, and they must be adhered to. Otherwise, it would not be really a useful exercise. Right. Now, there's a time for a short quiz, and you can type your answer in the chat box. The question, one question only: which one of the following statements describes the most important purpose of introducing elective courses in the undergraduate medical? I read it again. Which one of the following statements describes the most important purpose of introducing elective courses in the undergraduate medical education? A, to allow students to explore personal interests and develop individualized career paths. B, to expose students to a variety of non-medical disciplines to improve their clinical acumen. C, to introduce modern medical approaches for the holistic development of the graduates. And D, to provide opportunities for students to improve on their weak areas in the curriculum. Please choose one answer, A, B, or C, and type that letter in your chat box. You have, let's say, 30 seconds to do that. Okay. A. All right, great. Yeah, it's, all right. 100% answer is A. All right. Please remember, you can choose one. You cannot choose more than one. This is single best answer question. And yes, even those who have chosen more than one, the A is included in that. That's great. That's great. And that is really the answer to this question. The most important purpose of electives is to allow students to explore personal interests and develop individualized career paths. That's the most important purpose. Okay, great. Thank you for responding. Let's move on. Okay, now types of elective courses. Types of elective courses can be based on the purpose and duration, and we will talk about both of them. First, the type of elective courses based on the purpose. The elective courses offered across the globe in undergraduate medical training can be categorized in 5 broad classes. Number 1, global or international health electives. 2, project or work-based electives. Career choice oriented electives. Directed electives, and wellness electives. Now, a little bit detail about these 5 types. The first global or international health electives. These are usually the students coming from the developed countries to the developing countries, and students get to see different range of clinical conditions and pathology not normally seen in home conditions. Number two, students' clinical skills and experience is broadened. And number three, students get the experience of working in the challenging conditions with scant health facilities. So that is the main intention of the global or international health electives. The second one, research and project-based electives. Of course, it's clear that it enhances research acumen and to inculcate skills to handle healthcare projects. Career choice-oriented electives is to that students can explore about their future fields of work and careers. And directed electives are the to support academically weak students to help them during the elective period and to help them choose the areas to strengthen their core competencies. The last one is interesting, the wellness electives. This is usually done in the preclinical years, and it promotes self-reflection and humanism and helps students to cope with the stress of medical studies. So this is introduced mainly in the preclinical years, and it's more useful for students who are finding it difficult to cope and settle in medical schools. So these are the 5 types which are based on the purpose. There is another classification, which is type of elective courses based on the duration. And the intercalated elective postings for undergraduate medical students can vary in duration, often categorized as short-term, medium-term, and long-term electives. So 3 groups. These postings are designed to provide students with hands-on experience in diverse medical settings and specialties. So we try that the electives actually involve not just theoretical exposure, but where students have an opportunity to have a hands-on experience involved in certain activities. The short-term electives duration is from 2 to 4 weeks, and these are quite common in medical schools. The feature of these short-term electives usually taken during short breaks or vacation periods focus on observational or introductory clinical exposure, often conducted in local hospitals, clinics, or specialized departments. So emphasis is on observational or introductory clinical exposure, these short term. Examples are observing surgeries in a surgical unit, shadowing a general practitioner, or participating in public health campaigns or workshops. One may think that students are already doing these things in their undergraduate program, but these electives provide them more time and a bit more depth than what is usually done in undergraduate program. The medium-term electives, their duration is 1 to 3 months, and the features include they offer in-depth clinical or research experience, includes direct patient care under supervision. So they may work in different specialties. For example, going to the oncology ward, right, and spending time there. So they take part in patient care, but of course under supervision. And it can involve interdisciplinary or interprofessional learning, as we mentioned earlier, that this is an opportunity where students can go and join other healthcare related areas like dentistry, nursing, or pharmacy, physiotherapy, or the speech therapy, etc. And they can learn about those skills during this period. The examples: rotation in specialized areas of internal, specialized areas, not general, specialized areas of internal medicine, pediatrics, or emergency medicine. Engagement in community health projects or rural health care settings, or laboratory-based research in medical sciences. The long-term elective is a bit different than the previous two. The duration is 3 to 12 months. This means that students take almost a year off from the regular course, and they may go for another training, and these students would usually graduate with 2 degrees, one in the, of course, medicine, and other the whatever course they have taken. The features include that typically part of inculcated degrees are extended internship, involves independent responsibility, though under supervision, and may contribute to research publications, thesis work, or substantial clinical training. Examples include pursuing a year-long research project in a specific medical field, comprehensive clinical training in a specialized unit such as cardiology or oncology, international postings in underserved areas or global health organizations. I believe that some medical schools in UK are also doing this kind of electives. So usually the course is a 6-year course, the undergraduate course for these students, because they take 1 year off for their these long-term electives. But the advantage is, as I mentioned earlier, that they graduate with 2 degrees within a period of 6 years. Right. Now, having understood the concept of electives and their types of electives and their main purpose of electives, let's look at the practical aspect, which is planning an elective posting. Now, first would be how to select the students. Selection of student by parent institution for elective postings. First one, while elective posting offer valuable learning experiences, not all undergraduate medical students may be allowed to participate. Now, this is different in different institutions. In some institutions, all the students are required to go for electives, whereas in others, there are certain conditions. The elective may be reserved for students who have met specific requirements, with a focus on the safety and preparedness for such posting, because if student is going out for these postings, so they need to be prepared, and they need to be competent enough before they go for these postings. A strong academic record is usually a key factor, often requiring a minimum CGPA or equivalent. So some institutions would have this condition that, yes, this is an elective period, and the students would go for elective, but it is not open to everybody without any condition. So for that purpose, student must have a reasonable academic record, and those who have not reasonable academic record, or those who have failed in the internal assessment, will repeat the relevant clinical postings during that period. Now, as I said, this is not a universal the situation. The different institutions have different policies. And one of the institution I was working was the condition that, for example, all those students who have passed their year 3 would go for electives, but those who have failed 1 or 2 postings, they would not be allowed to go for elective posting, but they would be asked to repeat their postings which they have not passed. So this is one policy, and in this way, the selection of student by parent institution for elective posting becomes relevant. Then, in designing an elective based on situational analysis and considering the available resources, the organizer should clearly spell out the specific learning outcomes of the elective. I think this is the most important point. Without specific learning outcomes, electives means nothing. So there must always be a purpose, always be a learning outcome. And later on, we will talk about this, that the assessment of the student performance during the elective would be based on their identified learning outcomes. Students who wish to choose an elective, they should be given certain information. They should have clear understanding of name of the coordinating faculty. So who is coordinating, or in other words, the elective coordinator in the parent institution. Supervising faculty, who is the internal supervisor and who is the external supervisor. Mentoring faculty, who is the mentor, who is supervising the student or helping the student. Details of the students allowed to join the course, the duration of the course, of course, the timetabling of the session, assessment procedures. Student must know how they would be assessed at the end of the elective. What resource material or support service are available to them, and what are the prerequisites. So these are some very important points about which the information should be provided to the students, and we should make sure that they understand all this information. So these are the references about the selection I was talking about. Practicalities such as travel, accommodation, as well as the risk management. I think the obviously travel and accommodation is important, but this aspect of risk management for the student and their elective supervisors also need to be addressed where necessary. For example, students are going for an elective in an area which so-called may not be very safe, or the facilities are not adequate. So that need to be the risk should need to be calculated and the anticipated. The time assigned for elective should not be utilized to cover any shortage in their other courses. Yeah, that's what I was mentioning in the previous slide as well, that some people have this belief that students who are weak in their academic or have they not passed their posting, they should be asked to do those postings rather than going into electives. Whereas other institutions, they feel that electives have their own advantage and the student academic performance should not hinder to them to get the benefits of an elective posting. So that depends upon the policy of the institution. Universities and Ministry of Health in Malaysia offer elective courses and postings. Yeah, in my situation here in Malaysia, this is a very well established practice. All the universities and the hospitals and Ministry of Health have the policies and the protocols where they offer the electives to the local and international students, and you can go to their website and find out all the details. For example, here, this University Malaya, they have a clear-cut policy for elective posting during application. For example, all applicants must fill the admission form as a clinical or research elective student and submit at least 6 months prior to the date of elective period. For processing. So all the details are given, and this is every university has this kind of offer and facility available. Similarly, you can apply to different hospitals under Ministry of Health, and they would have their policy and protocol, and you need to follow that before students get that opportunity. Right. Now, that was about the preparation, mainly the selection of the student and the policy of selecting the students, and the offer or the services given by different institutions and Ministry of Health. Let's move on to the next aspect, which is implementation of elective posting. So you have planned, you have selected the students. Now, how do really want to implement it? For a successful implementation of an elective program, the organizer should ensure that the following things have been considered before, during, and after elective placement. I think that's a good approach, that we divide the things, what we need to prepare before the electives, what need to be done during the elective, and what need to be done after the elective. I'll go in a bit more detail about these three. So steps before elective. Of course, choice of elective by the student from the available options are proposing a new option. So obviously the student has to choose an elective. It may be one of the option already provided by the institution. Our student may propose a new option, but obviously that need to be approved by the elective committee and elective coordinator. So second, for each student, appointment of internal supervisor, usually the mentor of the student. So once student chooses an elective, so they have an internal supervisor. As I said, in our setup, is mostly the mentor of the student. Process of application for placement is usually coordinated by the elective coordinator. Then identification of personal learning outcomes. Students need to set their own personal learning outcomes, which will be included in their elective plan. Usually we say that they should be specific, measurable, attainable, relevant, and timely, are what the acronym of SMART. An example of SMART personal learning outcome is, while on my elective placement, I will participate in the postpartum nursing care of mothers who have given birth naturally and mothers who have had a cesarean section, in order to better understand their contrasting needs. So you see here it's a very clearly stated learning outcome, that what student wishes to do, or what he or she should do, and how they should approach it. But if the students are going into a group rather than individual, then they have to identify the group learning need, or learning outcomes, and it must include the cultural competencies. What I mean by cultural competencies means that this will empower them to expand their cultural competencies, such as supporting one another as peers, developing group management, teamwork, and public speaking skills. What it means that apart from the specific learning outcomes, these would be the additional learning outcomes which would apply to students who are going in a team or in a group rather than an individual. Choosing an elective placement that is best suited to achieve learning outcomes. So means that we have identified the learning outcomes, like I gave that example, and then we have to choose the appropriate place, right? So learning outcomes would dictate where the elective placement would be. When choosing an elective placement, students need to think judicially about what type of placement would best suit the learning outcomes. So it's important that we are very clear about the learning outcomes of that elective postings, and based on that, we would choose the most appropriate place where students should go for their elective posting. Students need to decide how to organize and prepare for their elective placement, how to achieve their learning outcomes, how their outcomes will be assessed, and what support services are available. So these are all questions which need to be answered while we are selecting an placement, selecting a place for the elective of that student. Placement for electives can be in other faculties or departments of the same institution or higher learning or a university. So means, for example, our university has number of faculties, and they are also health-related faculties. So student may opt to do their elective in one of the other faculties within the same university. In other, or it can be in other institution of higher learning, medical institution in the same or other towns of the country, or places of future work like Ministry of Health departments, or it can be an international electives. So they, based on the learning outcomes, based on the resources available, based on the facilities available, so one of these three options can be chosen for placement of electives. Obviously, this requires flexibility within the time of type of electives included as a curricular component. International electives are commonly a part of curricula of medical school in the developed countries. For example, a compulsory elective exists in all medical schools responding to a survey in Australia and UK, and 16 of 17 schools in Canada. I have personal experience of supervising these international students who come from developed countries, and they, for let's say, a few weeks, and they do their electives in the developing countries, and with their clear learning outcomes. So other steps before elective: identification and appointment of external supervisor in the host institution. So once we have selected a place for the placement for elective, then obviously we need to identify an external supervisor in that institution, and it should be there may be interinstitutional agreements in these situations, and the external supervisor would be selected based on the relevance or suitability, and terms and conditions and expected responsibilities would be clear to everybody, and of course consent and agreement is needed. Most of the communication and correspondence is done by the students, so students are encouraged to do this so that they get to know their future supervisors and place of elective better before they go there. A key principle is that students should lead the process and fully engage with the host supervisor. The host institution participation in the planning stages and close liaison with the students prior to travel is likely to contribute to the elective success. So as I mentioned earlier, it's important that student is directly communicating with the host supervisor, so everybody is clear and they know what are the requirements and what are the limitations. So when the students, before the students go there, they are really clear about the situation and their expectations. So in this way, they would be better prepared for these electives. This includes ensuring clarity of expectations by and of the student together with beneficial outcome for the host institution and the community. This is one important point that any host institution would prefer to have some benefit as well. So the benefit is not only to the student as an elective, but their elective has some benefit for the host institution as well. Good communication and preparation between student and host will engender team spirit and inculcate the student within the community appropriately. So it cannot really be overemphasized that a student is fully involved in all the process for the better conduct of elective posting. So that is before the elective. So what need to be done during the elective? While on placement, students need to create and collect evidence for their activities to show how they meet their learning outcomes. Obviously, this is very important and this is the main purpose. So student, while is during the elective, they have to collect the evidence to show that they have achieved their learning outcomes. And these evidences may be in the form of a logbook or a supervisor's report, written reflections, maybe photographs, or maybe videos or audios. So different sorts of the activities being recorded as an evidence, and that is what students need to do during the elective. Student must ensure that they follow the guidelines on confidentiality, consent, and copyright, etc., while collecting these evidences. Of course, this is another learning that if they are recording something, video or audio, or taking any pictures, they must be careful about the confidentiality and the consent. And again, this is a part of learning during that exercise. Maintaining attendance record is recommended. I think that's again important, that the host supervisor must sign the attendance record of the student. Now, once student has completed the electives, what they need to do after the elective? First, students' elective need to be assessed, and students need to show evidence of how they have achieved their learning outcome. That's very, very obvious that without this, the students may not be really performing their best during the electives. But once they know that they need to be assessed and they need to show their evidence that how they have achieved their learning outcomes, that compels the students to perform better and vigilantly during their elective. Reflective writing is the most commonly used tool as evidence because it makes the learning deeper and promotes critical thinking. Apart from this reflective writing, the other methods of assessment, I think I'll be talking about in detail after a short while. Now, support for elective postings. Monitoring the elective course is a crucial element for its success. Students have to be supported by a member of staff, usually a mentor, to facilitate elective throughout the process. And as we know that mentorship is one role of medical teachers in it, as it has been described in the literature, and especially this in AMI guide by Harden. The mentors can guide the students or mentees under them during their elective posting. And this is obviously an extra work for the mentors and the course coordinators to handle the elective course, including the assessment. Obviously an extra work, but once we realize the benefits, I think we would be or should be willing to do this extra work. During monitoring, it is important to assess the knowledge of how much students or mentees grasp. Means that before we send the students for electives and we give them briefing, the mentor has to make sure that they assess that how much have the students understood about their elective posting, because if they are not clear about what is expected of them and what they would be doing there and what kind of facilities are available, what kind of environment is there, they may not be able to perform well. So before sending them to the elective, the mentor should make sure that students understands all the relevant information clearly.
इसको तो बंद कर देती हूँ, मरियम बोलना नहीं, हाँ?
Mentors play a great role.
एक ही जगह कैसी हो, मैं बोलूँगी नहीं, ठीक है, हाँ.
Mentors play a great role in helping their mentees to reflect on their experiences and learning from elective posting. So basically, mentors or supervisors have a major role to play here to monitor the students, to help the students, and to have a reflective report on that, usually a standard format of reflective writing, which is agreed upon by the faculty or organizer, would be very helpful. Effective communication between mentor and mentee is important to guide the students, which is obviously very, very important. Now, educational activities for elective posting. So we have learned how to prepare for the electives, what we need to do before the electives, during the elective, and after the elective, and how we need to monitor the student activities, the role of internal supervisor and external supervisor. Now coming to this educational activities for elective posting. The kind of educational activities offered for electives range from meeting individual educational needs to exploration of likely career pathways with many factors influencing the choice. So basically, there are quite a long list of activities that can be offered in the electives, the covering different areas and the needs of the student, and they're quite detailed given in the AME guide number 88 about it. In the United States, electives range from courses like ethics, leadership, health policy, and foreign language to specialty-specific electives. So these are few examples from the United States, some of the activities which are offered for electives, and some very important, for example, learning about ethics, learning about leadership, learning about the health policy in the country, and are learning a foreign language. Short elective courses generally cover the fields of education, research, community posting, or other specialty-specific courses like laboratory electives, palliative care, like working, for example, in old homes or nursing homes, neurology, emergency medicine, surgery, radiology, etc. So these are more than what is taught in undergraduate curriculum. Now, here is a short activity. I would request the participants to suggest a non-medical topic. Important is non-medical topic for a short elective posting that would help medical graduates in improving clinical practice. So condition is that it should be so-called non-medical topic for a short posting, which is, let's say, about 4 weeks. And it should, this elective, non-medical elective, should help and improve their clinical practice in future. So please write your answer in the chat box. Only just one activity which you think is the most appropriate. Maybe give you 1 minute for this. Let's see. Ethical use of AI, crafting anatomy, leadership, AI in healthcare, basics of AI, leadership, entrepreneurship, teamwork, professionalism, entrepreneurship, telecommunication, biotechnology. Then is the audit of medical records. Yes, interesting. Learning the business. Learning the business of medical profession, management, cross-cultural learning, teamwork, communication, auditing, language learning. So the number of cultural competence and diversity, number of very, very interesting and useful options. Somebody wrote the CPR, community group talk, leadership role, startups. Yeah, obviously, this is the age of AI, and many topics would be related to that. It's a very, very useful list. I think I will copy that in my list of these non-medical topics for short elective postings, and I might share with you as well. Right? Thank you for participating in that activity. So let's move on to the next part, which is the educational activities for elective posting. So here I have listed some examples: creative writing, public speaking, additional language, play therapy, physiotherapy, occupational therapy, health management system, record keeping in hospitals, nutrition, criminal justice, court system, constitutional law, climate change, and complementary medicine. Yes, some of these topics obviously have been mentioned by some of the participants as well. So these are a few examples of the activities that can be offered during elective posting. But obviously, the important point would be that whatever activities an institution is offering, they should have the facilities available for that, or they should have the sort of some kind of understanding with other institutions where the students can go for their elective. Now, coming to again, a very important component of assessment of students for elective postings, and this has been a very hot topic during my interaction in the WhatsApp group on the challenges about the electives, and we will address that in a bit more detail. Students' elective need to be assessed towards the end of the course and posting. Aim of assessment is to judge whether they have achieved their intended learning outcomes. Assessment of elective outcomes should be kept simple. That's very, very important point here. It should be kept simple, because this has advantage in letting student and host institution to be flexible and allows for variability in supervisors' quality. Now, we know that we cannot have one standard method of assessment of electives, because the nature of electives would be different, very, very different from each other. So we can have some sort of the broad rules or broad outlines, but we cannot have one assessment protocol for every kind of electives. And this simple method of assessment can also encourage honesty in reporting, and especially when reflective accounts are included with no expectation of a right or a wrong answer. So students should feel comfortable, should feel confident in reporting whatever has been done without having fear of being penalized. Assessment of elective can be done either by measuring the percentage of attendance, 1, or completion of a logbook, 2, or submission of a project work or evidence of learning or an assignment, 4, 5, and namely presentation in a seminar or in a conference. So we can ask the student to present their report to the faculty, or recording the reflections on learning in different combinations. So these are a few options, and they can be used in different combinations. For example, logbook and the report on the project work, or an assignment, or presentation of the report to the faculty, or to a committee in the faculty. These could be the different methods of assessment. Host institution should be asked to evaluate and give written feedback on the students' achievement. So another important component of assessment is the written report by the external supervisor. And this report should not only look at the specific learning outcomes, but also at the broader personal development areas alongside clinical skills and professionalism. So the supervisor's report, the host institution supervisor report is a major component in the assessment of student. Peer review, if students are going in a group or a team, is a team elective, then peer review can be an invaluable source and incorporated as part of critical evaluation of the final assignment. Students now, how to encourage students based on their assessments. So student may be rewarded based on their performance in assessment. For example, student with best performance is sponsored for presentation in a national or international conference, and we may have sponsorship from different agencies in the community. Top 3 achievers may be asked to make presentation to the whole faculty. There may be book awards, or there may be certificate of appreciation. And in long-term electives, of course, there would be certificates, diploma, or degree. So in this way, we can have an outline of assessment of students' performance during the electives, and they can be rewarded in different ways. So just looking quickly at the advantages of elective courses are posting, mainly addressing the rationale for introducing elective courses in the undergraduate. And this is one example I copied from the reference below. Elective courses, they promote transformative learning, which can be instrumental learning or communicative learning, and then responsible thinkers, critical thinking skills, work performance, and clinical psychomotor skills. So this diagram includes both the generic or soft skills as well as the specific or clinical skills, showing the benefits of elective courses. Here are some reasons for students to choose elective courses. First, they explore interest. Student can select electives to explore interest outside their standard curriculum. specialize. Student can take electives to delve deeper into the specific areas within their field of study. Broaden perspectives. Student can pick electives to learn about different cultures and broaden their perspective. Career pathways. Student can take electives to help them pick up their future career and specialty. So these are some points from the students' point of view. Then these are some quotes I have taken from the SPICES model. The electives are a way of coping with an overcrowded curriculum. One of the major
हमें फेंक दो इसके पजामा शर्ट फेंक
One of the major problems facing curriculum planners in recent decades has been the enormous expansion of medical knowledge. And this has been associated with development of new disciplines, as well as with expansion of knowledge in existing disciplines. All of us are aware of this problem that it seems there is too much to cover in a short period of time. So curriculum planners accept that medical curriculum cannot be expected to cover all areas of medicine, and electives are a way that students can tackle what are regarded by them as deficiencies in the curriculum or topics of particular interest. So some areas in the curriculum which are not being taught formally are not being taught deeply enough, and students feel themselves that they need some more training in that. So this can be an opportunity for them. So rather than covering everything in the curriculum, some of these areas can be covered during these electives. Electives are means of providing students with increased responsibility for their own learning. Obviously, students choose their own topics and they work for their placement. So that definitely increases the responsibility for their own learning. The onus is on the students to select their own activity, to plan their own elective period, and to carry out their program of work. Electives can facilitate career choices by students. Like we said earlier as well, that some students may explore their interest in areas which they perceive as their potential career choice. And this elective provides an opportunity to students to explore further into those areas and to make a well-informed decision. Electives can meet students' individual aspirations. Students vary in their interests, needs, and expectations. These elective programs can be seen by students as being flexible enough to be relevant to their aspirations. So that really gives an opportunity to these students. Electives can bring about attitude change. This is very interesting. I went through this example that and it really struck me that this can be a very, very useful thing to do. One of the most important outcomes of elective periods is often the change of attitudes, students' attitude towards their work, their future career, patient care, and other aspects of medicine. And the example is here that a 4-week elective in cancer education sponsored by University of Pennsylvania Cancer Center gave medical students opportunities to learn about social, cultural, economic, psychological, and interpersonal aspects of cancer. So they have these 4-week electives in a cancer center. And the outcome was that the prior to electives, the students expressed a degree of hopelessness for cancer patients. And after the elective, it was shown that students' attitude had become more positive. So this is actually a glaring example that how electives can be very, very useful in training of these future graduates. Right now, Having said that and praised all those things and advantages, and obviously there are challenges during elective posting, and we need to know how to handle those challenges. And we should realize that these challenges are for everybody, for all the stakeholders, which are there. Maybe challenges for institutes, challenges for course coordinators, as well as for students. Designing an exclusive elective course suited for the requirement of some student is, of course, labor intensive. It needs to do a lot of extra work. Even after designing delivering such an elective course demands extra efforts and time. Designing is not the only issue. The implementation takes more effort and time. And the course coordinators and the teachers, they have to handle this in addition to their own core courses as well. Assessment of students in these elective courses is never going to be easy and definitely time consuming. Challenges for international elective postings are different than the national or local. International electives, there may be cultural issues, there may be ethical considerations, travel and accommodation arrangements, travel and health insurance, approval by health and education monitoring authorities, health hazards for students and the patients. These are apart from huge financial aspect. Then some students perceive elective as a touristic opportunity. So this is a common problem. This is very, very common problem. And many of the participants during the discussion mentioned this, that students think that this is a relaxing period. This is a touristic opportunity. They go to a place and they stay there for a few weeks as a tourist and come back. This can have negative influences on learning outcomes and impact upon the students' attitude, approach, and participation. So what we need to do about this? Exploring motivations for electives will lead to clearer definition of the intended outcomes and ensure that social accountability principles are considered. So when students are applying for these electives, talking to them and looking at their learning outcomes would help us to handle this issue. Elective outcomes need to be defined, realistic, and designed to facilitate personal development and socially accountable change within the students. So we need to clarify to the students there that there are certain specific learning outcomes. There is a certain program, discipline they have to follow, and they would be monitored, and the activities would be recorded before they go for these electives. And they should not think that this is just a relaxing period. We must make them realize that this is a very specific activity, and it has very useful aspects and the learning outcomes that need to be achieved. This requires clear strategies by all parties involved, the home institution, the host community, and the student. The elective must be underpinned by reflective preparation. So reflection should be even before going there, and that what need to be done. The elective must be underpinned by reflective preparation around ensuring clear, explicit and shared objectives for the electives, background understanding of the context, and the practical preparation. Challenges for elective posting: written guidelines outlining the students and their school roles and responsibilities, including liability issues, health and safety, and risk assessment. So I think the written guidelines covering all these areas can play an important role in telling the students that what is expected of them. And the logistic issues need to be anticipated and managed. Right. So having covered all this, I just want to now share with you some of the concerns which were expressed by the participants during my discussion in the WhatsApp group. So I have collected their concerns and suggested some remedies, the practical points in implementing about the elective posting. These are real concerns which are expressed by the people who have been involved in these activities. First one is that existing curricula may be tightly packed, leaving little room for electives. So we know that the overall content of curricula need to be evaluated for its relevance and in present and future times. So we need to look at our curriculum. There are some areas which are redundant, but we are still keeping in our curriculum. Difficulty aligning electives with the core curriculum, that was another concern. Those answer is that students are encouraged to identify their areas of interest in the curriculum or weakness in relation to the curriculum to work on during these elective posting, and they are guided to choose such topics and areas. In this way, the electives would be very well aligned with the core curriculum if we keep these aspects in our mind. Challenges in managing timetables for elective alongside core academic and clinical commitments. Of course, this is an issue. Managing electives definitely increases the workload of the faculty. The formation of elective committee and appointment of elective coordinator may help in streamlining the processes involved. And we must realize that the number of tasks may be assigned to the students as well. This is a quote by one of our participants, and I think it's a wonderful quote. And I would like to share with all of you that electives should be an extension of the curriculum encompassing topics areas that would be relevant in the next decade, but not covered in the present curriculum. I think it's a wonderful thought, and the worthy participant has given some examples as well, that Python language for medical research, drug development, regulatory affairs, robotics in medicine, medical writing, AI and machine learning in medicine, biostatistics, etc. Right. So this is, I think, a very useful tip for all of us. And another is, quote, the elective modules can be completed with collaborative partnership with other non-medical universities in the same or other countries. So it's not necessary that the electives must be done in the medical universities or institution. Idea is to push students to develop skill set that would complement their medical education in future. So another was that the topics for electives, how to expand the scope, how to come up with topics. You know, some suggestion is that student may be invited to propose topics, and topic may be shared with other institutions. So in this way, we can expand the number of topics. Interesting topics for 100 to 250 students. Yeah, of course, if that's the number of students in our one class, it would appear almost impossible to have topics for individual students. So in this way, the student may be encouraged to work in groups on the topics of their interest. So that may be one way of handling this issue. Different topics every year. Of course, we cannot have a new topic for every year. It's so not easy. So it's not necessary to give an entire list of new topics every year. We may ask the faculty to add, suggest some new topics if possible. Infrastructure for elective, of course, is challenging, but we need to develop infrastructure once only. And if we have done it comprehensively, that would not be a challenge anymore. And then appointment of elective coordinator or formation of elective committee may be helpful. Next concern was motivation. Every year for the same or similar topic in the faculty, of course, if faculty is same faculty is looking at the same topic every year, it would be very boring for them. So we may rotate the topics among the faculty, and faculty may be given a choice to choose a different topic than the previous year. Time slot for electives, to find time in the already congested program. I think I have partially answered that previously as well, that with the realization of their benefits and relevance, we must create slots. Maybe need to look at the present content of the curriculum in terms of its relevance to present and future aspects of medicine. The next concern, motivated students, where to find such students? Yeah, it's a common complaint as well. But most of the students may not be familiar with the concept and the benefits of electives. A thorough introduction to electives, their usefulness, the process of conduct will definitely motivate most, if not all, of the students. Follow-up of elective results into something productive. That's again a very, very important aspect, that whatever we achieve in the electives, that should not go into vain. There should be some productivity. So presentation of selected electives in national and international conferences, book awards, recognition certificates, additional points for admission and postgraduate program are some ways to make this exercise productive, both for individual and community level. Here is another quote about this by one of our participants. Clear directions to students for utilizing their time during the electives with learning objectives clearly laid down would be an effective teaching learning approach. And then lack of clear laid down of choices is also a factor, as most of us were not aware of the entire list of choices and followed the ones our seniors agreed. So clearly the students were not aware of the whole list of the topics, so they were not exposed to that. So without that, it would be difficult. Some medical schools have 2 elective postings, one in preclinical phase and other in the clinical phase. Students can choose non-clinical topics in the first elective posting, but must choose a clinical topic in the second elective. And we have gone through some of the example of non-clinical topics, that maybe even healthy cooking, new language, play therapy, etc. This is by courtesy of Professor Dr. Sitalal. He is one of our worthy member in our WhatsApp groups, and he has put it beautifully in all these non-medical electives in medical undergraduate curriculum. I think it's difficult for you to read from here, but as I have shared these slides, so I think you can read from there. But he has covered quite nicely quite a number of areas in this medical tourism and the financial literacy, the entrepreneurship, and the cinema and medicine, and the narrative medicine and art application, music therapy, etc. Another concern that assessment standardizing, evaluation methods, and ensuring fair credit distribution across varied electives is difficult. I think I have mentioned a bit about it previously, that we need to use generic rubrics. Different electives cannot be compared with each other, and assessment is based on the learning outcome. So we have to see each elective in its own form rather than comparing with others. Some students may not be able to access certain activities due to financial or travel issues. Yes, of course, but not every elective posting need to be in distant areas. Some of our students chose institution in their hometown or different faculties in the same university. So having minimum requirement of financial support. Without proper mentorship, students may struggle to choose electives that align with their goals. Of course, mentors have a very important role to play. Diverse elective experiences can lead to inconsistent educational values. I think this is a bit misconcept about electives. Electives are not supposed to be exactly the same. Each elective has its own educational value, necessarily not comparable to other electives. Electives are perceived as a way to relax rather than learn about something they don't have previous exposure to. A pre and post interview aptitude test based approach might change it. We have discussed this in the detail, and this is a good suggestion as well, that at the pre-interview, the aptitude assessment of students would be helpful. Students need to be counseled and learning outcomes clearly defined. However, some relaxing and tourism time must be included in the schedule. So students should be given an opportunity to go around that area, and some time should be given for that. Too much variety of elective topics in one of the main problem. The example given was that there are 40 students and 7 to 8 different topics. Obviously, feasibility must be studied and elective managed accordingly. So definitely the institution can limit the number of elective topics based on the feasibility. Elective is not added to main scorecard or CGPA that leads to student not participating electives. Yes, that's true, but other ways of awarding may be used, which we have discussed previously, and opportunity, for example, to present findings in conferences. Structured assessment is also a challenge within permissible rules. We have mentioned this, that generic rather than structured assessment should be used. Now, this is another quote by one of our participants, that during COVID-19 pandemic, we had mainly questionnaires distributed by Google Forms. Now the students can go back to the lab or do some community work. I and other supervisors have presented the results from the questionnaires at international conferences, and now we are in process of publishing the work. So the students will have publication during their medical studies. So this is a clear example of the extraordinary usefulness of these elective postings during our undergraduate curriculum. And I think that is my last slide in this presentation, and I will be happy to answer if there are any questions. I think the part I enjoyed best was the last one, where people had their concerns and the how to address that. So if there are any questions, I would be really happy to answer that. Or if there are any suggestions, please do share with us.
So thank you very much. This is Dr. Bilkis from Peshawar. Sir,
yes, ma'am. Yes, ma'am.
Sir, I have some queries and some suggestions as well, but I think we have, of course, it was a very comprehensive discussion, and you have already, answered a lot of concerns. Sir, it's a connection locally, nationally, and internationally. I mean, I was going through the participants.
Right.
So what I
आज
want
हमने
is
करना
that
है
is
वो उठा
there
लो सर
any
बेटा मेरा बेटा यहाँ से वो जो वो थे
somebody, please, others
सिलेबस वाला पेज
mute
उठाते हो
yourself, please.
इधर
mute
पड़ा होगा
yourself.
इधर हाँ
This is disturbing the whole discussion. Yeah, sorry, Dr. Bilkis,
ये
can
ये
you,
इसके
yeah.
नीचे हाँ
Yes, Dr. Bilkis, can you say it again, please? Sorry.
Yes, sir. Sir,
Disturbance.
sir, just wanted to know that can we all offer the electives that are available at everyone's institutions, because we are connected now globally. So, we have to struggle and sign MOU. Currently, my school have signed an MOU with the University of Milan, Italy, with the Surabaya University, Indonesia, and of course, some of the students take initiatives and they go to the local institutions like Shaukat Khanam for oncology electives, and they go to Shifa International in Islamabad and Aga Khan University in Karachi. So they do have the opportunities. That is the student struggle. But when we look into the international level, because now most of the students, those who are opting for the USMLE pathways, they really need to have electives at the international level, and they should have the exposures of at least a very good, strong travel history and electives in about 6 to 7 institutions, and in particular in US. So, I mean, we are all connected now globally, so we can help each other in inviting students, not more than 2, and make the platforms available for those students to take the opportunity and go to the electives, and then they will at least explore the different cultural areas where Malaysia is one of them, because we usually don't think of Malaysia, we don't think of China, we don't think of other countries, and we're just rushing and saturating the entire program of UK and US. So I think we should better give the student an opportunity to explore such areas, and if they want to pursue their career pathways in those areas, I think they're most welcome to do that.
I think, madam, that is an excellent comment, and sharing your experience. I think you seems to have quite tremendous experience in this area, both locally and international, and its benefit and the links with other institutions. I think that's the best example of conducting these electives, and to fulfill the requirement, for example, USMLE. Again, you mentioned the institution, the excellent institutions. So definitely, even just going and visiting those institutions by these medical students would be really, really helpful to them. Thank you for sharing that experience. Yes, Dr. Fahad Azam, please unmute yourself. Dr. Fahad Azam.
Yes, sir. Sir,
Yes,
thank you
please.
so much, sir, for such a good webinar and giving us such valuable information. So my question is that you also mentioned that most of the times we do not make these electives a formal part of transcripts or CGPA. So how do we ensure that given that in the allocated time, students do complete their electives?
Yeah, you see, the very important point, and this is something which we need to do before elective. Our learning outcomes should be manageable. In the SMART acronym, M is for manageable. So we should not be really too ambitious in our learning outcomes. And we should not take elective that's the only opportunity for student to learn. So they should be manageable. And as I mentioned, that we should give some free time as well to the students so that they enjoy. If somebody is going to a new place, I think it's good that they have an opportunity to visit that area. So I think we should be very, very considerate when we are defining our learning outcomes. They should be manageable within that particular time. I think that's important. But if we are too ambitious, then obviously everybody would be under pressure. Student would be under pressure. Internal supervisor would be under pressure. External supervisor would be under pressure. And sometimes people really give up. They say we cannot fulfill this. So what's the point in making an effort? So I think that's very important point which you have raised, that the limitation and the feasibility within the time and the manageability should be the factors contributing in making such decisions.
Thank you so much, sir. Thank you.
Yes, any other comments or questions? All right, I think.
May I ask another question, please?
Yes, please. Yes.
Sir, what opportunities can you give us to be an electee in some of the medical education programs?
Sorry, I didn't catch that.
So as far as we are concerned about the electives for the undergraduate medical students,
Right.
what opportunities your institution can give us as a medical educationist an opportunity to be exploring a new area for medical education? How can we approach Malaysia?
Okay, yeah, I think the number of universities in Malaysia, they are offering these postgraduate courses in medical education. Some examples are University Malaya or University Science Malaysia. If you write a message to me, I can give you a list of universities which are offering these opportunities, and then you can contact them directly.
Okay, thank you, sir.
Right. Okay, Dr. Abida, please.
Thank you so much, sir, for another informative webinar. I just wanted to ask regarding Shifa College of Medicine, we have electives as a mandatory part of the curriculum. So is it a fair idea to make it as an essential part of the curriculum if the institute is really committed and they provide all the logistic support? And according to SPICE's curriculum, is it a fair idea to make it an essential part of the curriculum?
Right. I think that's fair. We need to understand the optional component of elective. The optional component of elective is to choose the topic. So it is mandatory to do the elective. That is part of the curriculum, and that is in many medical schools. But students have option to choose the topic of their choice. So as long as the students have that opportunity to choose for themselves, I think it's quite fair. It's quite fair. We have been practicing that. At the moment, we have these electives at end of year 4. It's a 4-week period, and every student has to do that, but they can choose the topic of their interest. I think that's fair enough.
Thank you, sir.
All right. I think I have learned a lot of things during this period, during the discussion, and while preparing this. Just before we leave, I just want to share just one more slide with you, which is my usual message. And that is this charity drive. May I propose to each participant to donate $1 or equivalent amount in your local currency to any deserving individual in your neighborhood or any public welfare organization in your community after attending every webinar conducting from this platform. So this is my usual request to all the participants, and I hope you can offer that. With that, I thank you for your support. As I mentioned, we are entering in our 6th year of these educational activities, and I'm really, really happy and proud of your constant support. Thank you very much, everybody.
Thank you, sir. Thank you, sir.
Thank you.